Hello, today we're going to talk about the toxicity evaluation that was done on Convitvax and on breast cancer immunotherapy that's used for breast cancer immunotherapy. The authors of the article are Maria Duarte, Geismar Carvalho, Yetsenia M. de Gouveia, and Angie Garcia, I'm very sorry for the pronunciation, Diana Ruiz, Teresia Gledhill, Eglis Gonzalez Marcano, and Anna F. Convit. So just a brief introduction. This study was made to show that the Convitvax, which is the vaccine that was developed by JCWO, is harmless. It doesn't cause any problems to the we'll see now to the mice that were used. And throughout the study, we're going to look at each axis in which it could have caused problems, but it didn't. So a brief introduction. Breast cancer, as I said in the other two presentations, it's a significant global health issue that has 2.26 million new cases that were reported in 2020, and for 2030, it's expected to increase from 21%, which is very significant. The standard breast cancer treatments, like other cancers, is chemotherapy, hormonal therapy, and also radiotherapy. But there are other emerging therapies that are like targeted therapies and immunotherapies, which is the one that is used in this for this vaccine. So the immunotherapy in this case is by using anti-PD-L1. It has shown some effectiveness in combination with standard therapies like chemotherapy and radiotherapy. And the Convitvax, which was created in 2006 as a breast cancer immunotherapy, combines autologous tumor cells with the BCG vaccines, the Guénin, the one that we talked about in the last PowerPoint that showed promising results. And all this was, of course, was with the formalin. We discovered that formalin was very useful for the association with BCG, and the results were far more significantly useful with formalin than without it. So previous studies, like the one we talked about last time, about Convitvax, demonstrated that a positive result in animal models, and it was also done on a small human pilot study. This article will present the toxicity, the possible toxicity that can come from Convitvax, and how it is not significant to be called unsafe. For example, it was tested to show the safety of this vaccine. And it was all on healthy mice, of course, because we can't start with we can't have contamination of the results with the mice that had, for example, underlying conditions. They were all tested to be healthy, and everything was tested on them. The study, as we will see later, it includes a local reaction evaluation, clinical laboratory test, like there was a urine test and the biochemical test. Also, there are necropsies that were tested, and there was a histopathological examination of the organs. We looked at the tissues of the organs to see if there is a problem with those organs after the injection of Convitvax. The methods used. So for the tumor induction, 41 cell line were used to induce memory-like tumors in bulb C mice. Bulb C mice, which are the same mice that were used last time, and it was to be like a model for the stage 4 of human breast cancer. The mice were obviously female because breast cancer happens way more in females than in males, and the 41 cells that were used for the tumor induction were taken from primary tumors for the autologous tumor cells homogenate. So the autologous tumor cells in homogenate that were injected are related to the 41 tumor cells that were I mean, the autologous tumor cells are the ones that like for the vaccine, they're used for the protection, are the same line as the ones that were induced to cause the disease, the human-like disease. So Yes, Convitvax, as showed in the previous article, was associated with tumor cells homogenate, with BCG, and with formaldehyde, all in specific concentrations, of course, to minimize unwanted effects. And the protocol that was followed was like the previous study that was done, I think, in 2015. It followed the same protocol, 2018. So 6 treatment groups were chosen. The first group is the control group with PBS. Nothing is supposed to happen to them. The second one was only a high dose of autologous tumor cells homogenate without any use of BCG or formalin or the Convitvax. Third and fourth one were respectively with a high dose of BCG and a high dose of formalin. Now, the fifth one is, I think, the most important. It is using Convitvax and formalin. And the last one, it was Convitvax and formalin, but with a higher concentration. It was 3 times the dose of Convitvax and formalin that is usually used. My interpretation is that this was used in case an excess of Convitvax was placed in the patient. What would happen? And we will see that even with those settings, there was nothing significant happened. So the mice that were used were 6 to 8 weeks old, and as I said, they were females due to the low breast cancer prevalence in males, and they were in controlled conditions, of course, to minimize any environmental effect on them. And the injections were done from day 0. Then each week there was an injection of the treatments, and finally a 4-week recovery period was done. The 4-week recovery period, basically, nothing was injected into the mice. It was only to see what will happen on the long term till 56 days. So 51 female mice were used for this toxicity study, and for the BCG group, we used a reduction in the subjects. The many parameters were measured, as for pain, discomfort, and distress, and this was all related to other parameters, which are weight loss, appearance, behavior, and of course, vital signs. Ethically speaking, euthanasia was done at the end of the experiment, a merciful death for the mice, and every 7 days, the mice were evaluated for general deficit and weight. We'll talk about general deficit and weight in the results. So the injection sites, the reactions of the injection. So when someone injects a vaccine or anything, there will be a reaction in the body, even for humans. Even when someone did, for example, the COVID vaccine, some people had reactions like blue, like a little bit of inflammation, which is normal because we poked into the skin. They were assessed for 24 and 48 hours post the treatment. This we're going to talk about it later. And the urine collection was done at day 28 at the last injection before the 4-week recovery, using something that we call Bayer's test strips and, of course, microscopic examination. This will be numerical results of the urine composition. So the next analysis was a hematological and a biochemical analysis. So for the hematological analysis, they were both, for the biochemical and the hematological analysis were both performed at day 28. The blood samples had to be anticoagulated with 1% EDTA, so that the hematological examination can be done more clearly, because of course blood coagulates alone, and for us to be able to see and to examine the blood microscopically, we needed to anticoagulate it for the biochemical analysis, like the levels of Na+ or other things that we'll see later. Of course, specific laboratory equipment was used for the analysis. Now, for the necropsy and the morphological evaluation, the necropsy was performed on 6 mice from each group at day 28. The organs that were evaluated will be shown later. This was also related to the histopathological analysis. It was the liver. It was I noticed that it was one organ for each system, or they're all, of course, vital organs, but it was the liver, the kidneys, the lungs. They are for different organ systems to test if, for example, Convitvax caused a problem in the digestive system. We would know. In the respiratory, we would know. So, as I said, the liver, the kidney, the thymus for the immune system, and the lymphatic, and lung tissue, of course, for the respiratory system. Now on to the results. So the results are going to be pretty simple because most of the time, and this is, of course, the best sign possible, the vaccine entered, it never went overboard. Sometimes there were surprising results, if I can say, but it was never significantly negative. So first of all, as general, 100% survival rate for the 51 mice, which is already a very good sign, during treatment or in the recovery period for the 56 days where they were treated. The body weight follow-up, we're going to show it later. It showed that the body weight didn't change significantly. It was very stable, but there was a slight drop in weight that was recorded for some groups at day 42. But as for humans, weight can vary from day to day very easily. Let it be from the activity of the body, for water levels even. So it's not statistically significant or biologically significant. Here we can see that the body weights stayed between 22 and 26 grams for 56 days, and the variation were very minimal. We're talking about, for example, if on day 13, a mice drank more, or something in the body made that its body weight went a little bit more, it would show here. But because the variation is only of 2 grams over 56 days, and the mice were only 6 to 8 weeks old, so they were still growing, it's not significant at all. So general deficit, it's a measure that is used that uses Clark's criteria, and it's to show the evolution of the mice here. It's an evolution not statistic. It's an evolution parameter. For G1 to G5, from G1 to G5, general deficit stayed at, I'm going to go down to show the graph, it's easier. It stayed at 0, which is the perfect score. It can be better than 0. So this is for G1 to G5. However, for G6, we noticed that on day 14, there was a push of the general deficit, but that was only for day 14. After that, it went down, and finally, during the recovery period, it was 0. It stayed 0 like the others. So this jump was due to a hyperactivity of the mice that were in G6, and but it's still not considered significant because it's not even a side effect. It just happened as a coincidental with because we're implementing the vaccine. So yes, okay. I'm gonna put the laser. Okay, so it's easier to show. Okay, so at the injection site, as we said before, after 4, 24, and 48 hours, the injection site was examined to see if, for example, the injection of the vaccine itself, the use of the needle, a local problem would happen. And fortunately, as we can see here, there are only minimal alterations of the skin. But as I said before, this happens to anyone, even to humans. When we put a vaccine, it's a foreign object that is placed, so there will be a reaction of the body. That's a good thing. The body reacts. Here you can see the lines, for example. Here the same lines, but it's very normal. The urine analysis is very important because if an abnormal number of wastes, for example, if it was found out that I say something very random, but that ketoacidosis happened, for example, and ketonuria, and the Na plus and K plus level would be flushed, for example, this would be a big problem for the nervous system of the mice. That's just one of the things that can happen. And as we can see in this table right here, leukocytes and all those important factors of the blood and of the system were not found in the urine. N means no, and the pH level stayed in the conformity. It's normal that the pH is a little bit low because urine is acidic, but it stayed the same, and it's very consistent between the groups too. Even the one that had a high concentration of Convit-Vax, it went up from 0.3, but it's very variable. So for the hematological analysis, it was done at day 28, and it was also another analysis of the mice's body and of the mice's status. There was a non-significant increase in white blood cells in G6. So this can be associated with the fact that a high concentration of Convit-Vax and of formalin was induced. And let's not forget that this is an immunotherapy. So it's normal that the white blood cell count will go up because of the high concentration. But the important thing is that for the group 5, the increase was not the group 5, which has the normal concentration of Convit-Vax. There was not an alarming increase of the white blood cell. So there was also, for G6, there was also a slight decrease in the monocytes, HGB and HCT, but they're also not considered biologically significant. This is all following, of course, guidelines that are supported by many other countries and many other regulations. It's not personal analysis of this is not significant. So also for the biochemical profiles, no significant changes in CR, ALP, and Na+, as I said before, were observed. So those are the two tables. This is the hematology profile. We can see that, where's the white blood cell? There was an increase for G6 here, but if you notice the standard deviation of each group, it falls into the standard deviation. For example, here 9.5 plus 1.8, it's 11.3. It still falls in it, so it's not considered significant enough. For the biochemical profile, nearly the same, which is impressive. Nearly the same for all the groups. I think that there are two that no, they are nearly the same, those two, and for the CR and LAP too. Now, for the necropsy and the organ weights, at day 28, the organ weights were measured, and there was an increased lung weight in G4 and an increased thymus weight in G2. Then when this organ weight increase was measured, it's important to measure the whole body weight increase, because if the thymus only increased and not the body weight, this can be significant, and this can cause, maybe it's not a tumor, but maybe it's an overproduction, over solicitation of the thymus, for example. But by doing the ratios of the organ weight to the body weight and the organ weight to the brain weight, there was no significant variations, and therefore the changes in the organ weight are not considered to be biologically significant. Now onto the histopathological findings. I think, yeah, this is the image. So to sum up everything that's written here, by doing a macroscopic evaluation, first of all, the liver, the kidney, the thymus, and the lungs, macroscopic means like by looking at it only, everything was fine. The color of the organs were fine, the size, there was nothing alarming. And for the microscopic examination, an H&E staining was used, and it showed that Convit-Vax shows no effect on studied organs. And we can know that by comparing, for example, the G1 to all the others there. It can be the same image, especially for the thymus. It's nearly the same image for all of them, which also shows that it's not dangerous. No signs of any fibrosis, necrosis, atrophy, or inflammatory were observed in any evaluated organs across the 6 groups, which is, of course, very important. I'm sorry. Okay, this is a repeating slide. Now the discussion. the discussion is not going to be very different from the result, but it's more of an interpretation of them. So the general safety evaluation of the Convivax, we're just going to repeat the parameters that were used to check that everything is fine. So it was done on female bulb C mice. All groups received 100 microliters of the corresponding treatment. So for example, G1, it's 100 microliters of PBS, etc. It was once a week for 4 weeks. And then a 4-week recovery where we looked at what happens on the long term till 56 days was done. And as said before, it was aimed to evaluate toxicity of Convivax at therapeutic concentration and the 3 times higher dose, which is the it says 5 minutes left in the meeting. I got this message. Sorry, doctor.
Sorry, Raja.
It said that there is 5 minutes left in the meeting.
No, it's okay. It doesn't work. It doesn't matter. The meeting continue.
Okay.
No problem.
So G6, which has the 3 times higher dose, was done to check up if there would be any problem with the Convivax, even with a 3 times dose. So just for statement, none of the mice developed a tumor of any kind, and no tumor cell proliferation was observed in the inoculated area of any organ. Moreover, all the animals remained in optimal general condition, and indicating that the vaccine, as prepared, did not induce any morbidity or cause of cancer in the evaluated time. It didn't cause premature death. It didn't impact their life. This is showed by the general deficit that we saw before, that stayed at 0 in the long term. So BCG, which is a component of the Convivax, is known for adverse effects like the local swelling, suppuration, and ulcers. After doing regular observations, mild localized reactions that were like papule or erythema in Convivax and BCG, Convivax and BCG groups were observed. However, within 2 weeks after in the recovery period, the reactions resolved spontaneously because the mice are, as we said at the start, immune competent subjects. They don't have any underlying issue. Oh, sorry, I skipped one. So formalin, as showed in the previous study, it is included in Convivax as a preservative and an adjuvant, and it's also used in other commercial vaccines, all in the same concentration, and no toxic effects were observed in the treated mice related to the 0.02% formalin. Now, onto the systemic effects. There was no sign of any systemic toxicity or abnormalities in the whole body weight, or in the organs weight or anything like this, and there are no changes in the organ to whole body ratio, like we said before. For example, like what happened to the lung of G4 and the thymus of G2. Also, no death, as we said before, and the general deficit score within normal range, except for the day 14, which has a hyperexcited behavior. Normal range means a 0. So the urine analysis, there was no pathological changes in the urine analysis, as we showed before. The pH and there was nothing like leukocytes or anything like this were found in the urine, and the histopathological analysis showed that there was no detectable variation in the normal architecture of the tissues. There is a histopathological analysis, which are the comparison between the tissue of G1, which is the control, to the others. Everything was fine with the architecture. There was no hyperexpression of anything, and the size of the cells were also normal. So a high predictive value for risk assessment was used. So what do we mean by this? Is that the hematopoietic system of the body of the mice is very sensitive. So if there was even a little change, it would have been measured. But even with those parameters, no significant changes in hematological parameters were observed, and all the values were within the normal range. I think that there are values that are in tables supplementary 1, supplementary 2. I read that in the article, but I didn't have access to them. I don't know if it's a problem with the with my application for the PDF, but I couldn't find them.
Oh, yeah. Okay.
So in general, Convitvax and its components had no toxic effect on the hematopoietic system. Now, the most important observation is the one that was done at the end, because we can't let a vaccine cause problems 2 months later, for example. An extended observation that lasted 8 weeks until day 56 showed that there was no issue with any of the mice that were used in any of the groups, and the results that were at 28 days were confirmed by the 56 days, which indicates that Convitvax and its components at the indicated concentrations are non-toxic. So onto the conclusion. I think I forgot to add something here, but it's not important. It was done here, remember. So to conclude the study, Convitvax deemed safe in the indicated dosage, time schedule and protocol, and even in the dosage that was times 3, it deemed safe in general. This encourages further development of and advancement into a phase 1 clinical trial due to the perfect safety, that there was no death, nothing happened. So a clinical trial can be applied, can be possible, and it confirms a safety profile and potential for patient applications.